We're diving into the complexities of Medicare and how it works with Covered California. A lot of people find this transition really tricky to navigate.
Absolutely. The way federal Medicare and state-covered California interact can be super confusing,
Yeah.
especially when it comes to figuring out who's eligible and what the penalties might be.
Right. So what are some of the biggest misunderstandings people have about this whole thing?
Well, one big one is that people think Covered California automatically cancels when you qualify for Medicare. That's just not true.
So you really have to be proactive?
Totally crucial. If you don't tell Covered California you're getting Medicare within 30 days, you could end up with some serious financial problems.
Okay, let's break down Medicare itself. Can you explain the different parts?
Sure. Medicare has a few different parts. Part A is for hospital insurance, and it's often free if you've paid enough payroll taxes. Part B covers medical insurance, like doctor visits and outpatient stuff. Then there's Part D for prescription drugs, and Part C, or Medicare Advantage, is kind of an alternative to the original Medicare, Parts A and B. It usually bundles everything together.
So choosing the right part depends on what each person needs, right?
Exactly. You really need to understand what each part covers to make a good decision.
Okay, so how does Covered California fit into all this?
If you're eligible for Medicare, you usually lose eligibility for those Covered California premium tax credits, and you'll need to cancel your Covered California plan to avoid penalties.
Are there any exceptions to that?
Yeah, there is one. If you have to pay for Medicare Part A, you might be able to keep your Covered California plan and maybe even qualify for some financial help.
What about automatic enrollment in Medicare? Does that happen automatically?
Most people aren't automatically enrolled. It's really important to sign up during your initial enrollment period. Otherwise, you could face penalties and gaps in your coverage. There is an exception for people who are considered disabled by Social Security.
And what happens if you miss that enrollment period?
You could have delayed coverage, higher premiums, and maybe even lifetime penalties. It's a big financial risk.
So what steps should people take when they become eligible for Medicare?
First, contact Social Security to confirm you're eligible and find out your start date. Then, right away, you should let Covered California know they can help you cancel your plan.
Are there any resources to help people figure all this out?
Oh yeah, definitely. Social Security Administration can answer questions about Medicare eligibility.
What about financial help to pay for Medicare?
There are Medicare savings programs that can help lower costs for some people, and Medigap supplemental insurance can help cover extra expenses. It's worth looking into those options.
So planning ahead and using the resources available is really key to a smooth transition.
Absolutely. Understanding the rules and getting help when you need it can save you from some really costly mistakes.
Anything else important people should know?
Yeah. Family members who aren't eligible for Medicare can stay on the Covered California plan, but their financial assistance might change. Also, you can keep your Covered California dental plan, but you can't change it.
That really shows how important it is to plan carefully and understand how both programs work.
Exactly. It's a complicated system, but with the right information and resources, you can manage the transition pretty well.
This has been really helpful. Thank you for explaining all the complexities of Medicare and Covered California.
My pleasure. It's so important for people to understand their options and avoid problems.
That was a great discussion.